Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. It's my privilege to be here with Dr. Maroof Ahmed from Pelago, one of the co-founders there. Thanks for joining me today.
Thank you so much for having me, Logan. I appreciate it.
I know that you are a physician. You were in primary care. You're not practicing anymore. And I think all three co-founders were physicians?
Yeah, absolutely. So we graduated from med school, and I had a passion and strong interest in the addiction space. Unfortunately, in the final year of medical school, I lost my uncle to tobacco addiction. It was tough. Family of immigrants that came to the UK, so my uncle was like a second father to me. So that was like incredibly tough. So from the final year of medical school, I wanted to dedicate my career to finding a solution in substance use. So initially started in research. It started as a research project, which was kind of fun. But the challenge with research is that after you've done the research project and you've published a paper, it stops there, right? So that's where we got the idea of Quick Genius at the time, which is now Pelago. We've rebranded. So we'll go into that in just a moment. And the concept behind it was really just to increase the access to substance use support. Our vision is to really have a world where everyone has access to substance use support. And that's what we've really been building over the last 6 years. So
when you say substance abuse support, what do you mean by that?
Yeah, so it's a
what do we have access to?
Great question. So it's a category that we spent a lot of time investing in creating is substance use management. And this is actually slightly different from substance use disorder or substance abuse, right? Because often there's such a stigma associated with substances, right? People don't like to admit that they have an issue with substances. People that might be drinking an unhealthy amount don't want to associate with the word addiction, right? There's a huge
or even
stigma.
a problem. I don't have a problem.
Exactly. 100%.
I do need to cut back. I don't have a problem.
Exactly, 100%. So the reason we spent a lot of time in this brand and in the investment of the category creation for substance use management is to really lower the barriers to accessing treatment and to get everyone speaking about drinking alcohol and whether they drink a healthy amount of alcohol. 90% plus of people within the US drink alcohol, right? Are you drinking a healthy amount of alcohol? Why not speak to one of our health coaches to find out, right? So really lowering that barrier and lowering the barriers to entry, which has been, a big reason for a lot of our growth over the last couple of years.
Yeah, let's talk about that. I mean, you are unique in our startup health community in terms of the way you've been able to scale. It's been exciting to see you raise, how much have you raised?
We've raised nearly 100 million.
100
total.
million, okay. Yeah. Not pocket change. You raised 100 million. You started in the UK, you came to the US, you've scaled up. What's that process been like?
Yeah, so initially very painful because I'm from...
Probably initially very exciting for a short period.
Exactly.
Very exciting.
Excited.
Then painful.
And painful because I had to have a conversation with my parents, twofold. One, that I'm now not going to become a medical doctor. I'm a family full of doctors, so that was a painful conversation. They nearly disowned me. But now we have an amazing relationship.
But first you raised 100 million? No.
Yeah. It was, well actually, they disowned me first, and then after raising 100 million, they started speaking. No, I'm joking. Hopefully they don't see this. But so that was challenging. And then secondly, we're moving over to the US, right? So my family are all based in the UK, so that was painful for many different reasons from a personal perspective. But in terms of the actual growth of Pelago, that's been very, very exciting on multiple different fronts. We started this as an idea. We really wanted to reinvent the delivery of care. The evidence base behind CBT and medication-assisted treatment was clear.
Yeah.
It's just very difficult to access. It's so inconvenient. Yeah. Imagine telling your boss that you want to take 6 to 8 weeks off work to go to a rehab center. There's a huge stigma associated.
Yeah.
We deliver everything at the comfort of their own home, so they don't have to leave their home. There's far less of a barrier to access it. There's, like I said, the point of entry, we want to reduce the stigma associated with having an addiction or reduce the stigma associated with seeking support for substance users, right? So that's something that we spent a lot of time investing in, and there's still a long way to go. 5% of the population are accessing support through in the substance use world are accessing support digitally. 95% aren't. And then if we look beyond things, 90% of people with substance use issues are not accessing treatment.
Wow.
Right? So there's still 90% of the people that are not getting the support that they need. And this is where we need to our work's cut out, and this is why we need to invest time in scaling even further and spending time in the US to really expand that further, because the problem is expanding.
Obviously, there's a massive person-by-person impact of tackling some of these issues.
Yeah.
But I know you also go to employers and to organizations. What are some of the ramifications for an employer to have a workforce that is struggling with sort of moderate addiction?
Yeah, absolutely. It's a great question, and the reason a lot of employers, over 150 employers now, are using Pelago, these are usually large employers with big workforces, is because of the sheer medical costs associated with substance use, right? They are sending folks to out-of-network inpatient services that can cost on average $100,000. So it can cost them a ton of money. So the big selling point of Pelago is the ROI associated with our solution. Across our book of business, we have an average ROI that's claims validated, medical claims validated of 3 to 1. So we're saving on average per member over $9,000. And this is really what's led to the flywheel of Pelago's growth, right? Because we're saving so much money for these employers.
Break down where those savings come from.
So the savings actually come from, and this is pure medical claim savings. So this isn't absenteeism productivity. Yeah. If we went into that, it would be far higher. But this is hard medical claim saving. 45% of that is from savings of inpatient services that they no longer have to go to. Now they've had successful treatment through Pelago. Around about 35% of it is through outpatient services that they again no longer have to go to. And the rest of it is through pharmacy claims. So they're now no longer having to go through multiple rounds of expensive pharmacy treatments as well. So there's a ton of saving from a medical standpoint, from a pharmacy standpoint, from a drug standpoint, and this is really what the employers value when we deliver our support at Pelago.
Do you get to hear success stories?
Every single all-hands meeting, every 2 weeks, we start it off with a member testimonial video. So this company means everything to me, right? But the mission is the most important reason we do what we do every single day. And
any story come to mind?
Oh gosh, I can go into there's too many. There was a story 4 weeks ago at our all hands meeting of a spouse. So it wasn't even the actual member. It was a spouse of a member saying, "You've transformed my relationship with my husband because he was addicted to alcohol. He had a love for alcohol that was ruining our relationship." So that was powerful because we've had many stories of members, but we don't often get them from spouses or children or grandchildren, and those one hit home the hardest because it's their relationship changing, and when we're seeing that impact, it's amazing.
Go back for a minute to this idea of lowering the barrier, because I'm curious about what it looks like for an individual to be sort of nudged into care, who is really far away from seeking therapy or a recovery center.
Yeah.
How do you nudge them? What does that look like?
Great question. So let's just say we partner with a large employer, 100,000 lives. They are very hesitant to share anything about their alcohol addiction with their employer. So step one is the employer says, "Hey, we've partnered with Pelago, confidential platform," right? So that's laying the groundwork. Then Pelago reaches out and says, "Hey," to certain members of the population, "Do you drink a healthy amount of alcohol? Why not jump on a call with one of our health coaches to find out?" Okay. So everyone jumps on a call. Everyone that drinks alcohol jumps on a call. Some people might call up. So Logan, you might call up, have a call with one of our health coaches, and the amount of alcohol that you're drinking is fine, right? But who's behind the camera? Justin.
Kevin, yeah.
Kevin might call up, and he's drinking more than he should be, right? And he actually needs the support that we're offering at Pelago. So the health coach, in a very non-judgmental way, will share, "Hey, Kevin, we can actually help support you here. We can help you. Why not set up a call with one of our health coaches, and we'll work on reducing that alcohol to more of a healthy amount. 3 glasses of wine a night is actually unhealthy." That might be a surprise to Kevin. That might be a surprise to many people that we speak to, right? So that's how we lower the barrier to entry, especially with substances. When we're going into opioids, right? So our opioid program is there for folks that have serious addictions to opioids, and more on the severe side of the spectrum. Yeah. But it's also there for folks that have just had a hip replacement and they don't want to get addicted to opioids after having opioids, right? So the prevention there. So prevention, everyone's heard the phrase prevention is better than cure, right? Yeah. And that's how we support.
Interesting. So what's next?
God, there's so much we could go through
Yeah.
here. So I think there's, like I said before, 90% of people with substance use management are still not getting the support that they need. We've got a lot of work
You just
and
got
a
a
lot of ground to
greenfield,
cover.
you've just
a
got
lot
a
of
big
greenfield to
market.
carry it. Absolutely. So that's the focus. I think one of the keys to our success, if we've always stayed focused, we could go into so many different other conditions, but we stayed focused in substance use management.
Yeah.
It's something that I have a personal connection to. It's something that the world needs right now, and it's something that we're going to continue to build out, improve our product, get more claims data, get more scientific evidence. We publish over 15 papers now. We're going to continue to improve our outcomes there and continue to offer it to all the employers, health plans, and members that need it across the US.
So still primarily tobacco, alcohol, and opioids?
Absolutely. So
Okay.
there are three
That's
main...
how you're going to stay.
Absolutely, and that's within substance use management. There will be natural expansions there, and we've
Sure.
continued to expand that over the last couple of years. And there are many other things on the roadmap. We just launched our adolescent program, so now available to all adolescents. Over that was about 4, 5, 6 months ago, which was great, and that's a huge issue. Vaping within teens, but also substance use within teens has been on the rise.
Yeah.
It's in line with substance use increases over the last couple of years, which is a 34% increase.
Wow.
This is leading to many different things, from adolescent mental health issues, adolescent suicide, which is on the rise, adolescent opioid overdoses. Opioid overdoses are the highest that they've ever been. So there's a ton of stuff to be done there, and I think for us it's staying focused. It's staying focused on the big problem that there is there, and continue to support the members.
Well, Maroof, you're doing good work, and it's been exciting to see it grow, but you're still just getting started. So
Yeah, absolutely.
keep up the good work.
Thank you so much, Logan.
All right, thanks for
Appreciate
taking the
it.
time with me.
Thanks a lot. Cheers.